Hello, welcome to Doc Talk Live. I'm with Dr. Efe Sahinoglu. Say it for me.
Sure, it's Shine-Olu, which I know is
Shine-Olu.
misleading because it looks like it would be Sahinoglu, but Dr. Efe is just fine.
Dr. Efe is fine. And what is the origin of your last name? What is your background ethnically?
It's Turkish.
Turkish?
Yeah.
Really?
Right, yeah.
Neat. I have some Turkish friends in town. I play bridge with one of them.
Is that right?
Yeah, Dr. Afsar. Were you born in Turkey?
Yes, I was born in Turkey, and I was about 10, 11 when we moved to the States with my family.
Okay, great. And I like what you said, that I said, what are we going to talk about today? And you said, whatever I ask you. So
Right.
so I like that. It keeps it wide open for me. Before we get started, if there's any questions that come up later, hopefully Dr. Efe can come on later on the rebroadcast and maybe type in some answers. Also, I posed a query to people that maybe visit our page. I showed some spines, some anatomic dissections of spines yesterday, and I asked people why they think the spines are curved. And so I'm interested in y'all typing in your answers, and maybe we can do a Doc Talk Live on just that little topic. But Dr. Efe is basically a primary care doctor. Is that right?
That is correct.
And this is deliberate, the perfect day to come in, because it is miserable outside, and I'm always sick in this weather. So I'm curious, what does the weather have to do with it? Why I don't get colds in the summer, but constantly getting sick in the winter. Any thoughts on the weather and illness? And are you more busy this time of year, for instance, or are different seasons associated with different problems for you?
Yeah, sure. So this time of the year, we do see a lot of the viruses that are just more present, and they very easily just make their way around to us with all the handshakings and huggings, or even just
so maybe being in closer quarters, being inside, we're not getting outside as much,
and that does have to do with it too. Right.
And then is there anything we can do? Excuse me. The struggle is real. Is there anything we can do, you think, to prevent the illness from the basic upper respiratory infections from getting to us?
Yeah, I would say wash your hands very, very frequently. That's how we get almost all of the viruses. So wash your hands very frequently, and pressed. But so really, those two, taking care of yourself and washing hands, I would say, is the number one. Is really what
good hand washing. And so what I've been told is that you like sneezing your hands, you shake somebody else's hand, you rub your nose, and you inoculate yourself.
Right, exactly. And then maybe open the door, and then someone else comes after you and touches the door, and they might say, well, I really wasn't anyone, I wasn't really around anyone who was sick, but you don't really know.
And so in a way, there's not a whole lot you can do for a viral infection. Is that right? Or are there things that you can do for a viral infection?
As a physician?
Yes, as a doctor, is there much you have to offer to treat these common viral infections?
So a lot of the treatment is focused on what we commonly refer as symptomatic management, or really helping to relieve the symptoms. Now, if these symptoms do not go away after a while, then we start to, because viruses do have often a course they run, and if these symptoms are occurring longer than we expect them to, we then do look more into it in terms of running tests and see if there's maybe a secondary bacterial infection developing and such. But often it's really more patient education, emphasizing hydration and washing hands and controlling the symptoms.
And so, excuse me, we'll get to my cough in a minute, but what over-the-counter stuff do you generally recommend, or is it just fend for yourself and just see what works best for you?
So, often depends on what symptoms they're having, because again, I explained to them that these are really just focused on relieving the symptoms.
Exactly.
And
let's say runny nose, can't sleep, sore throat, cough. What about those type of symptoms?
So, I'm a very big fan of natural things. So, saline water irrigation, I'm big on that. Or things like nasal steroid sprays, like Flonase, and then some of the non-drowsy antihistamines can help.
What's
really,
an example of that?
Kind of like Zyrtec or Claritin or.
Now, are those over the counter?
Right, they are.
Okay, super. So my cough, sorry y'all, but I think my cough is like related to the weather in terms of just like a type of asthma. At this time of year, I'm always coughing, and if I move to a warmer climate, the cough seems to abate. This time of year, so any thoughts on that? Do you see a lot of weather-induced asthma?
Yes, we do. I do see a lot of them. Often they're basically weather-induced, or whether that flares up allergies, that flares up asthma.
And this has gotten worse as I've gotten older. Tell me a little bit about direct primary care. What exactly are you? What does that mean? Isn't all primary care direct?
Well, depends on. You would think so, but depends on what you mean by, are they all direct? So direct primary care is a practice model, which I use in my clinic, Birmingham Direct Primary Care, and basically it's saying that the primary care is provided directly to the patient from the physician with really no third parties, no interferences. So patients, they contract directly with physicians contract directly with patients. And by doing that, we're not using insurance for the primary care purposes. Now, our clinic.
So patients would still have insurance,
right?
Like if they broke their arm and they had to go to the emergency room.
Exactly.
Okay, but what if they had, let's say, a chronic condition like diabetes, and their sugars needed a lot of management from a primary care doctor? How would that work?
Yeah, so that would be such patient would fit such greatly to our practice. So as a family medicine physician, I really do everything else all the other family medicine physicians do. But what this model allows me to do is it increases patients' accessibility to the physician. Let me rephrase that. And allows me to spend a lot more time with them by not having.
But you don't bill their insurance.
I don't.
So do they bill their insurance? Who bills the insurance?
So, good question. Insurance is not into play here. Just like we don't use our car insurance for putting fuel into our car for every single thing we do with our cars. We don't necessarily need to use our medical insurance for the not very costly stuff.
Well, let's say I had diabetes,
Mm-hmm.
and it was controlled by diet, but I also took some medication
Mm-hmm.
for it. And that medication, I don't know, making up a number, was $300 a month,
Mm-hmm.
and my insurance covered that. Excuse me. So I would see you, and I would pay cash for you, and then I would submit to my insurance for the medication management piece, or how would that work?
Sure. So when you see me, that's included in the monthly fee. So how our clinic works is that our patients pay a monthly fee that's often less than your cell phone bill, and for that, that includes all the physician's services. That's all the visits, no copays, and then they get hour more longer visits, hour.
So
more.
that includes labs and things like that.
No, so it's the physician's fees. So it's basically everything I do for them.
Okay, so what if they need blood work?
Sure. So for what we do is that we've contracted with local labs around where we get wholesale prices, so that, for example, a hemoglobin A1C, which gives us an idea of what your blood sugar is over 3 months, is $5. It's not the probably at least $100 or $200. That's the marked up price.
What if you needed, let's say, a Doppler on their leg to make sure they didn't have a blood clot, or an echo on somebody's heart to check a murmur that you're picking up on?
Sure.
How would that work?
So again, I can order those through some of the radiology places that we have contracts with that are much cheaper. Special prices that much cheaper. For example, Doppler is around $200, or echo is about the same, really, about $250. And so, I always ask the patients, I say, do you want me to order this so that radiology place can bill your insurance, or do you want to pay them directly? For example, if it's the beginning of the year and you have $5,000 deductible, where it's going to be counted towards your deductible as a marked up maybe $1,500. I'm just making some $1,000 image. Which one do you want to do?
Is there a difference between what you're calling direct primary care and what some people call concierge medicine?
It is. So with concierge medicine, patients pay a monthly fee, which is often a good bit higher than direct primary care. But also, in addition to that, the physician's office bills the insurance for the physician services. Where in direct primary care, you're just paying that monthly fee for the physician services, and for the labs, it's just a few bucks. You get the wholesale negotiated prices, and then we often a lot of direct primary care physicians dispense medications, and those are at wholesales too. So we don't mark them up. We just.
So how would somebody decide between direct primary care route, concierge route, or just straight insurance? It sounds like there's 3 pathways an adult could take.
So I wouldn't place direct primary care with insurance, because it's not replacement for insurance. So if somebody breaks
so they
their
should
arm,
have insurance anyway.
They definitely should. Definitely should.
So how would you contrast direct primary care to concierge to I'm just going to go see my primary care doctor, what I call the regular way?
Sure. So regular way is, and this is just from testimonials from my patients, that the regular way, you're sick, you might be able to get it in 2 weeks, and by then it might be too late, or what you wanted to ask a question about might have.
So the regular way is inefficient.
It's inefficient.
Okay,
exactly.
And so how about direct primary care versus concierge then?
So then it comes to a matter of if you want to pay, around $75 a month, or several $100s a month for the same service.
So concierge is more expensive.
Right.
And you feel like it's the same service. It's not a better service.
Not in my opinion.
Sounding a lot like cable versus, sometimes it's hard to sort out, like Spectrum cable versus, just getting Wi-Fi and pulling up Netflix or something like that.
Right.
So.
And what's neat about direct primary care is that often we're all busy people and we have our jobs, and we're sick, and we sometimes don't we just sometimes put off on going to the doctor's office because you don't want to take off 2 hours to go wait in the waiting room, and then maybe not be able to really explain your problem because you're in and out, and you only get to see the doctor 5-7 minutes, but sometimes it's just something that you can explain to your doctor over a text. And my patients can text me. They can text my cell phone. They can send me emails. We can do video chats.
So
it's a lot more efficient.
it sounds to me that with both concierge medicine and direct primary care, relative to what I think of as the way medicine has been delivered traditionally over the years, is that through these sort of sign-up programs, if you will, you are getting more efficient access and more access to your doctor. And so it seems like if you don't have a primary care physician, like I see patients who need a primary care physician and they don't have one, at least for their hypertension or any other medical illnesses they may have, and they don't have a primary care doctor. And you're saying, hey, you need a primary care doctor, but it could take months to get in.
Right.
How long would it take to get in to see you?
Oh, I see them the next day. I can see them the next day.
So the waiting list is not all built up.
Right, exactly. And then not only the waiting list to be seen the first time is built up, but there's also not a waiting list to be seen the next time, or when you need a refill, you don't have to come back in 3 weeks because as well, we've kind of gotten used to it in the fee-for-service system. Doctors have to see 30-40 patients a day and don't have any room in their schedule. So one common thing about both concierge-style practices and direct primary care practices that we see a fewer number of patients. Our patient panel is around 600 to 700 as opposed to several thousand, which does allow us to have that increased availability to our patients.
And you're in Hoover, right?
I'm in Hoover.
So where exactly is your clinic in Hoover?
So it's close to Data Drive, whereby close to like the Whole Foods and Best Buy.
Gotcha. And is there a website people can?
Yes.
And I'll put it up on Doc Talk Live, or I should, but go ahead. What's the website?
Right. They can learn more about our practice at www.birminghamdpc.com. That's birminghamdpc.com.
Perfect. Any questions? Or are we good, Blake?
We're good.
All right, Efe, I appreciate it. It's a pleasure to have you.
Thanks for having me on, Dr.
And if people have questions, they can. Thanks, Blake.